Um, Welcome everybody. My name is Marty Mascari. I am a contractor with the North Central Texas, under the North Central Texas Council of Governments, under the Area Agency on Aging and the Aging and Disability Resource Center. And welcome you all today. We are blessed once again to have our partners here to talk about Medicare Mondays. And our partners are the Area Agency on Aging, is who I work with, and it's just another department under the Area Agency on Aging, and then the Better Business Bureau Foundation Houston chapter. And so we have Angel here from them as well. But before we get started, first of all, today we're going to talk about making enrollment decisions and looking for love, the romance scam and scams. And so let's talk about CEUs first, and then we'll get rolling. So for those of you that are attending today looking for CEUs or certificates of attendance, we are providing complimentary CEUs for licensed social workers and licensed professional counselors in the state of Texas. Now, those of you that have other license in Texas or have license outside of Texas, you're more than welcome to go through the process, get a certificate, submit it to your jurisdiction, but just know that the only jurisdiction we're set up for is in Texas for the two licenses. You also are welcome to get a certificate of attendance. The rules or guidelines for each of them are the same. Today's webinar is worth 1.5 hours of CE credits. You must attend the entire live webinar in order to qualify, and you must complete the Google evaluation form that should pop up at the end of the, as you close out of Zoom today. If it doesn't pop up, no worries. We're going to be emailing that to you in a follow-up email as well. I realize some of the companies and some of you individuals even have pop-up blockers, and that could create a problem. The survey will be up for 1 week from today. And then if you'll give me about 3 weeks after that to get the certificates out, I would certainly appreciate that. And then after that date, if you want to contact me, if you're not getting one, every once in a while there's an error in my little system that puts them out, that decides who gets them and who doesn't. So please reach out to me after that date if you don't get a certificate. So Melinda, if you don't mind, I'm gonna turn it over to you. And Melinda Gardner is my cohort. She works for the Area Agency on Aging. And so I'm going to let you introduce our speakers, if you would.
All right. Thank you very much, Marty. And thanks again, everyone, for joining us today. And I will let you know that Felicia Warner will be our presenter for our Medicare topic of Medicare enrollment decisions. We are from the North Central Texas Area Agency on Aging, and we are a SHIP agency, State Health Insurance Assistance Program. And I'll let Felicia explain that to you as she begins her presentation. Felicia, I'll turn it over to you.
All right. Thank you so much, Melinda. Good morning, everyone. And if there's anyone from Kansas City, congratulations. Yes, in the Philadelphia area, yes, you all were in the greatest Super Bowl ever played, and it was a wonderful game. And Rihanna, thank you. My name is Felicia, and I am with the Area Agency on Aging and of North Texas, and this is a program of the North Central Texas Council of Governments. We are known as SHIP, and I'll explain that later, but we also partner with the Texas Senior Medicare Patrol, and they're here today to provide information on fraud and abuse. And Angel will be presenting more information later on in this presentation. SHIPs are federally funded. The SHIP program was established by the Congress, and their work is funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. So there are 54 SHIPs and grantees in all 50 states. There's one in Puerto Rico, Guam, the District of Columbia, and a place I want to visit, the U.S. Virgin Islands. Nationally, SHIP oversees a network of over 2,000 local sites. We have over 12,000 team members, including staff and in-kind professionals and volunteers. In addition to SHIP services, many grantees provide senior Medicare patrol services, which help Medicare beneficiaries protect, detect, and report healthcare fraud, errors, and abuse. And SHIP also trains volunteers and in-kind members to provide these services. Members are highly trained. I myself started as a volunteer, and I'll talk about that a little bit later. But we assist our beneficiaries with Medicare coverage, Parts A and B, Medicare Advantage, prescription drug plans coverage, and the Medigap. And also for our beneficiaries who their income is low, we help with them filling out forms for Medicaid, Medicare Savings Program, extra help, and low income subsidies. And SHIP also does outreach, and we provide information at presentations, we distribute information, we conduct enrollment events, and we participate in health fairs, senior fairs, and other community events. And also, just one more point, and I think this is really awesome that a lot of people don't know, that we help with appeals. And you have a right to appeal any decision by Medicare. So we would love to talk to you more about that. So we're, again, there's over 2.5 million Medicare beneficiaries and their families and caregivers, and over 330,000 adults under the age of 65 with disabilities. And we outreach to more than 4 million individuals at public presentations, enrollment events, health fairs, senior fairs, and other community events. So how can SHIP, oh, this is our local SHIP. So you can find your local SHIP by visiting the shiphelp.org or calling that number on the screen. So help people in your community, volunteer for SHIP, and the SHIP central source is a central source of information and expertise and technical assistance for our grantees. And I have to say, last year was my first experience with open enrollment, and that is our busiest time. And we anticipate we may reach capacity early again. So if you would like to partner with SHIP, please reach out to us.
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer. And I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, the SHIP program may also be known by one of these names.
I always love that video. I started as a volunteer back in 2009, 2010, and I just moved over to now I'm working and doing something that I absolutely enjoy. So let's get back to Medicare enrollment periods. Medicare enrollment periods, some people are automatically enrolled in Medicare Parts A and B, and you should be automatically enrolled if you are collecting a disability insurance or SSDI for 2 years. You're eligible for automatic enrollment. You should sign up for Medicare during Medicare enrollment periods. And this year, starting January 1, 2023, there are several changes to Medicare enrollment periods, prescription drug coverage, and Parts A and B costs. And these are our objectives. I'm sorry, objectives to understanding Medicare. And we'll just go through each one of those today. Thank you. Medicaid and CHIP, there are over 90 million people on Medicaid and CHIP. Medicare, over 65 million. Even in the marketplace, there's over 14 million, and over 50 million are enrolled in Medicare Part D, and which includes the standalone prescription drug plan, as well as Medicare Advantage plans that offer prescription drugs. And so to determine whether you are automatically enrolled or you must take action, some are automatically enrolled in Medicare, as I mentioned, while some beneficiaries must act to enroll. And let's take a look at this. So do I need to enroll in Medicare Part A and B? Well, you need to define your work status. Are you working and have health insurance? Are you married with your partner's insurance? So you need to look at that from your perspective to decide, do I need to enroll in Medicare? And there's different circumstances. Next slide. Medicare enrollment, and there you see on the screen, there are 5. So we'll start with the initial enrollment, general enrollment, annual enrollment, Medicare Advantage enrollment, and there is the special enrollment. So the initial enrollment period is 7 months, which includes the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. General enrollment, annual enrollment, which is the busiest time of the year, and beneficiaries receiving Medicare should review their health plans. The initial enrollment period, again, is 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after that. And this slide really explains the initial enrollment period, the IEP. You can only enroll in Medicare or make changes to your Medicare during certain times of the year. Your first enrollment period is the initial enrollment period, which is the IEP. And it's again the 7th month period, and that's again 3 months before, the month of your birthday, and the 3 months after. And this is before January 1, 2023, when I think this is an absolute, and I knew that you had to wait to enroll. So this shows what went on before January 1st, 2023. So for example, if you turned 65 in June and waited until September to enroll, your coverage would not begin until December. And this, of course, could result in unwanted gaps in health insurance coverage. So beginning in 2023, January, the Medicare coverage will be effective the month after enrollment if you enroll in the last 3 months of your IEP. This change applies to any enrollment for any person who meets the requirements and to enroll in Medicare after January 1, 2023. So if you turn 65 and you wait till June to enroll, your coverage will, you wait till June and then wait until September to enroll, your birthday in June, and wait till September to enroll, your coverage will begin in on October 1 instead of December. So that prevents any gaps in coverage. So the general enrollment period, is January through March 31st, and coverage begins July the 1st. That's the old one. So the next one is the general enrollment, which all that changed in January 1 of 2023 of this year. The general enrollment period, the GEP beginning in 2023, Medicare coverage will be effective the month after you enroll. If you enroll in the GEP, then of course, it runs from January 1 to March 31st of each year. In the past, if you enrolled in Medicare using the GEP, your coverage would not begin until July. And again, that helps reduce gaps in coverage. For example, if you enroll January 1 and you have to wait until July the 1st, your Medicare to start. But here again, in 2023, your coverage will start the month after you enroll. So that's really a positive change, that you don't have to wait for coverage. And so we're here at the special enrollment period, work related. This is only related to work. The Centers of Medicare and Medicaid Services have established a new special enrollment period for Part A and B for those who experience exceptional circumstances. These flexibilities expand Medicare enrollment opportunities, reduces gaps in coverage, and helps prevent late enrollment penalties. And we'll go into a little bit more detail regarding the special enrollment period. So we'll go to the next slide, which is Medicare Part C and D. Medicare Part C and or D enrollment periods. Medicare Part C, which is the Medicare Advantage plan, and the Medicare Part D prescription drug plan. The Medicare Advantage open enrollment period takes place January 1 through March the 31st of each year. And we're in that period now. You can switch your Medicare Advantage plan to another Medicare Advantage plan or original Medicare with or without a prescription drug plan. You can only use this enrollment period if you have a Medicare Advantage plan. So if you have any questions, please put that in the chat, because this is really important, that there's only a certain window of opportunity to switch plans, and you can only do it that one time with a Medicare Advantage plan. And then to our annual enrollment period, which is every year, October the 15th through January the 7th, which your plans start on January the 1st. And this is our busiest time of the year. And when Medicare beneficiaries, they should always consider their access to healthcare providers that they want to see, access to pharmacies, access to benefits and services that you need. And you should also look at the total cost of your insurance premiums, deductibles, and cost sharing amounts, and the quality of your customer service you receive from your plan. Medicare Advantage plans open enrollment again is January 1 through March the 31st, and the coverage begins the first of the month after you enroll. So again, you can switch from a Medicare Advantage to another Medicare Advantage, or go to original Medicare, or go from original Medicare to a Medicare Advantage plan. So you have a lot of flexibility during those 3-month periods. And special enrollment. Again, if you move out of your service plan area, you have Medicaid and Medicare, or qualify for low-income subsidies, your plan leaves Medicare, the program, or reduces its service area, you enter or live in a long-term care facility like a nursing home. You get or lose or have a change in your extra help or Medicaid status. You are sent a retroactive notice of Medicare entitlement. You can leave or lose your employer insurance or union coverage, and you have 60 days, and other exceptional circumstances. And then the 5-star special enrollment period is just December 8th through November the 30th. And you can switch from your current Medicare plan to a 5-star quality rating plan. And the plan starts the first day of the month after you enroll. And again, our special enrollment period, Medicare is granting special enrollment period for exceptional circumstances to allow beneficiaries to add, drop, or change their Part D coverage if they find a better option after 2022 annual enrollment period. So the special enrollment period will be available to all beneficiaries who use a covered insulin product and begins on December 8th, 2022 and ends December 31st, 2023. Beneficiaries may use this special enrollment period one time during this period. And if you have any questions, please put those in the chat. Again, my name is Felicia Warner. I'm with the Area Agency on Aging. Thank you.
Okay.
All right.
Oh, there you go. There's Melinda right there. Okay,
Yes.
go ahead. That's it.
Now we will have Angel provide information on our scams.
Oh.
Angel, I'll turn it over to you, and I believe you have remote access.
Wonderful. So, hi everyone. I am Angel Hansick. I'm the outreach specialist for the Texas Senior Medicare Patrol, which is a federally funded program housed in the Better Business Bureau's Education Foundation. So let's see if I can click through these slides. Anything happening for y'all? Oh, there we go. Okay, so what we're going to be going over is romance scams today. So it's going to be very on theme since tomorrow is Valentine's Day. And so before we get started, speaking of hearts, our first scam that we're going to be going over is cardiovascular genetic testing. So this is a very big scam right now, and it comes in many different forms. So a few different examples of genetic testing fraud is you can have it for cancer screenings, DNA screenings, dementia screenings, Parkinson's, any sort of genetic issue or disease that you can be tested for. There will be companies offering a free quote unquote test, saying that you will just swab your cheek, send it in, and it's going to be wonderful. Medicare is going to pay for all of it, and then you're going to know if you're genetically predisposed for any of these issues. But unfortunately, the fact of the matter is that only very, very few Medicare beneficiaries qualify for this test to be covered. And so it's actually only 3%. And so it's a super, super small number of people. And so these individuals, these companies will ask for your Medicare number, and they will bill Medicare. And so what will either happen is that Medicare will just stamp it, pass it through, and you will never get your test result back. Or Medicare will flag it and realize that you do not actually qualify for this test to be covered by your Medicare, and you will have to foot the bill, unfortunately. And they are pretty pricey tests. So please, we really, really encourage you, do not take any sort of test, even if it's at a health fair, if someone is soliciting you, unless your doctor recommends and prescribes it to you. So yes, beware. If you do not pay the bill, it may be sent to collections. If a test or product is free, then you won't have to provide your Medicare number. And please never give your Medicare number or date of birth, any sort of personal sensitive information to anyone for any tests that are not ordered by your doctor. So not just any doctor, but a doctor that you know and you see and you trust. Okay, so let's go ahead and go into the romance scam when we're looking for love in all the wrong places. So according to the FBI, a romance scam is whenever a criminal adopts a fake online identity to try and gain trust and affection, build a relationship with someone. And then the scammer will use the illusion, the idea of a romantic relationship, or even just a very close friendship to try and manipulate the victim into sending them money or sending them services and stealing information. And so here we actually have a video of Special Agent Christine Banning describing what romance scams are. So this is actually someone from the FBI. Let's see if I can get it to play. There we go.
Romance scams usually involve a perpetrator assuming an online identity, and it's for the purpose of tricking victims. So what they do is they search out vulnerable women, generally speaking. Men can be targets as well, but it's generally women, usually above the age of 50. Anyone is subject to this. If you're online, if you're using the internet, as long as you have money and you're willing to give it, then you could be a target. They'll hunt through these various networking sites and they'll find somebody who may be a good target, and they use what the victim has put on their profile page. So you have to be very careful about what you post, because they'll use that to manipulate the victim. And they'll develop a relationship very quickly. They'll try to endear themselves to the victims. They'll say whatever the victim wants to hear, and they will often propose marriage quickly. So they develop this intense relationship, and they do seek out people who may be divorced or widowed. So they're people who are vulnerable, who may be desperately looking for love. And again, they will manipulate that victim and endear themselves and gain their trust, and then they'll start asking for money. The perpetrator will state that they have an emergency, that they need money for a job maybe overseas, that they've have some type of medical emergency and they need funds. So they promise that they'll repay the victim as soon as the victim sends them money, but the victims never receive their money back. From what we can tell, these are usually criminal organizations that work together. And once a victim becomes a victim in that they send money, they will oftentimes be placed on what's called a sucker list, and their names and identities are shared with other criminals, and they will be targeted for future recruitment. I always tell people when we try to spread the word, if you don't know somebody, don't send them money. Try to research that person's profile that you're getting involved with, and try to do some due diligence. But you know, we're all human, we all make mistakes, and I just hope victims who have fallen prey to this can learn and hopefully not enter into another scam. We have seen victims become victimized again. So I just ask that victims try to learn from the experience and try to share their experience with others so that other people can learn from their experience and not become victimized as well.
Anyone can be a victim. There's no shame in it. There's no need to be embarrassed. And unfortunately, it can become a very vicious cycle. And so I really love how that is framed there. Let's see if I can get it to go to the next slide. There we go. Okay, so according to the Federal Trade Commission, there was a ton of money lost to romance scams specifically. So in 2020, $304 million. And so right here, we were at kind of the start of COVID. Things were really peaking. So everyone was very online. So it was very, and people were isolated. It was a very scary time. And so scammers really took advantage of that, right? And so they took up a lot of fake dating profiles, fake Facebook pages, and started manipulating people into sending them money. So on an individual level, that meant that there was a median loss of $2,500. So each person that was scammed, that's about the average of what was being lost there. And this is rapidly growing. So from 2016 to 2020, the money lost was increased more than fourfold. So that is so much money. That is insane. And so please just be wary whenever we're online. It is increasing as we are getting more and more online, chronically online. And so I am sure that y'all have heard of something called catfishing, right? So whenever we are on Facebook and someone has a fake profile, or if we're on Christian Mingle or Plenty of Fish or Tinder, it is very, very common. And so let's get into that a little bit. So has anyone ever heard of, it's called Tall Hot Blonde, the Tall Hot Blonde case? So this is actually a real true crime case from 2011. And it's an example of catfishing. So what had happened was there is a 46-year-old man who went by the screen name of Marine Sniper, who met an 18-year-old online who went by the name Tall Hot Blonde. And he pretended to be 18. And so he was actually catfishing her, claiming to be someone younger than he actually was. They developed a romantic relationship online, and then his daughter actually found his profile and told her mother about it. And so his wife sent a letter to Tall Hot Blonde explaining the situation, saying that she was being catfished, saying he's actually married with children. He's 46. He's not this 18-year-old in high school or fresh into college. And so this young woman, she decided to stop seeing him and started seeing his coworker instead, who also was on this same dating site. So super, super messy. And the original man, Marine Sniper, the 46-year-old, got jealous, and he actually murdered his coworker for speaking to and going to visit Tall Hot Blonde, this 18-year-old that he was seeing online. So super scary. These scams, catfishing can have really intense consequences, but it gets even more convoluted because Tall Hot Blonde was not 18. She was in her 40s, and she was catfishing him as well. She was using her daughter's pictures and claiming to be 18 years old, and was talking to people that she thought was 18 as well. So they were both catfishing each other. And so it is very messy. It is very scary. You cannot trust, everything that you see on the internet. I'm sure you'll hear that so much. But yes, please be super, super careful whenever we're online. And this is just one case, and a very dramatic and intense case. Whenever we're talking about scams, we're talking about money loss here, but this is just a very dramatic example that I wanted to share with y'all. Okay, so this is kind of where these scammers are finding their victims. And so they're looking on online dating sites. So like we were saying, like that Tinder or Plenty of Fish, Christian Mingle, there's all sorts of different ones online. There's also cell phone dating apps, social media, of course, is a hot pot for it. So we're talking Facebook, Instagram, anywhere where we can just build a profile and claim to be someone else. And unfortunately, these scammers are also looking in obituaries. They're looking to see who is recently widowed, who is going to be lonely, who has been maybe left behind by loved ones and therefore vulnerable. And some of them aren't even going for romance. Instead, they're going to be trying to claim that they're a friend. They're someone from high school that maybe you don't remember, or an old ex-coworker. And so anything to try and establish a connection and a relationship with you. And so you might receive a request or one of those messages saying something along those lines. So some ways to spot a fake Facebook profile. Here's a few things to look out for. First, let's look at their profile picture. So go ahead and search by image. Go ahead and take that image, and there's the Google reverse image search. You can search that image and see if they got that from somebody else's profile, or even a magazine or a website, if it's a model that they're using. Is this picture too perfect? Are they absolutely flawless, completely edited, and just so gorgeous? That could be a red flag. And if they only have one picture up on their social media, well, now that's kind of suspicious. Because why don't you have more? Because maybe they have found this perfect picture online and they've decided to use that one. Now next, look at their about section, their little biography. Is it blank? Is there no personal information there? Or are there only places like New York City or California, these big, easy to research places, and there's so many people. So of course they're from Houston, Texas, that's just where I'm from. So it's an easy example. Also look at their friends, look at their friends list. If they have too many friends from just random places, that could be a sign that they're just sending out a bunch of random friend requests to everyone, to anyone they can, to try and build their profile up and make it look like they are legitimate. Because a lot of people will just accept whatever friend requests they get and not really look at it. So they don't have any friends from like one centralized area. Also check their timeline, check what they're posting. If there's a lot of links and ads, then that is a red flag as well. And then if there's a lack of interactions or posts, why are their friends not commenting on anything? Why aren't they posting anything? It may be because this is not a real person having real life experiences. And so please look out for these common red flags. And so here's a few tricks that scammers will use to try and manipulate someone into forming a relationship. And so what they'll do is they'll craft these elaborate aliases and profiles with pictures that are not theirs. And these profiles are going to be super appealing to their targets. So very, very handsome, muscular men, or very beautiful young women with perfect hair and perfect makeup. The scammer may have multiple fake profiles on different sites, but they use the same alias. So they keep that same fake name and fake pictures, but they're on all the different websites. Just in case their targets decide to check them out. And so they can go see, oh, they do have a Facebook, so they must be real, even though I found them on this dating site. Okay, here is a quick little video that kind of just goes over what it looks like, this romance scam in action.
Looking for love in all the right places? Like popular dating sites, mobile apps, and social networking sites? Ron seems like a perfect match for you. He's thoughtful and says he can't live without you. He says he's from the US but works out of the country. He says he wants to visit but says he can't afford it. He asks you to send him money. Last month it was medical bills for his sick aunt. This month he needs money to fix his car. Next month, who knows? Ron wants your money. Don't send it. The person pretending to be Ron is a scammer. He'll tell you anything to get you to wire cash right away. He'll never run out of excuses. If an online love interest asks you for money, walk away, no matter how compelling the story. Report scams at ftc.gov/imposters. Looking for love in all the right places? Like popular dating sites, mobile apps. Looking for...
Okay, there we go. We got it. All right, there we go. And so to kind of highlight what that video just went over, whenever you make a connection with someone, it will start the grooming process with the scammer. So the scammer will start to try and build trust with you. They'll have a lot of contact with you, building that relationship. So they're constantly texting you or sending you pictures online or things like that, but they'll never meet you in person. They'll start isolating you from your friends and family. Like, no, like you shouldn't go out this weekend. Like, let's sit on the phone. Let's watch Netflix, online together. Don't go out. Don't talk to them. Don't tell them about us. Or that they'll request that you're no longer on social media or dating sites. They don't want you to find other people. They don't want you to make those connections with someone else because they want to manipulate you and your feelings. They don't want you to find someone who's real and where you can get that emotional connection from. They'll start gathering a lot of information about you. So they want to know, they want to know about your kids. They want to know about your hometown and your interests, which is how they build that relationship, because they want to know as much as they can about you so that they know different ways to get money from you. Be patient, and they'll be patient and will communicate with you for days, weeks, months. This relationship can go on for even years, to try and perpetuate the scam, see how much money they can get from you, build as much trust as they can to make it feel very real. And they'll start to become very, very possessive. And so for ladies, this is typically what we'll see for trying to attract someone. So they'll usually have an attractive profile photo, and they'll boast that they are financially stable. They'll maybe say that they're widowed, but they're a father, they're a family man, but they lost their wife. Typically, they'll say that they're military. This is an easy excuse for being away overseas, and so you can never see us. Y'all can never meet face to face because he's serving elsewhere. Typically, they'll say that they're very religious and patient, kind. They'll boast that they're a great listener, and they'll start telling you all these things you want to hear, and they'll text you all the time and send you cute little gifts, and it's all full of big promises and big dreams. We're going to get married one day. I'm going to buy you a house. We're going to have an amazing life together. But of course, this all falls short. And so here is an actual person who is a victim of this scam telling her own story.
Initially, he would read my wall, I would read his wall. We would post things. He would like things, I would like things. Then it got to, we would just share emails. We started sharing pictures. I knew that just based on the conversations that we'd had, that he was someone that I would like to meet. I felt a real soul connection with him right away. We sang to each other, we prayed with each other. We'd talk about what happened at church on Sunday. There wasn't an immediate talk about getting together. He was trying to finish up a job in California, and he needed some money to help finish that job up. And so I sent him. I thought about it long and hard. I prayed about it, and I've always been a very giving person. And I figured if I had money in the account, that I could send him some money, and he promised to have it back within 24, 48 hours. And I thought, could do that. No one would ever know, and I'd be okay. But, one thing kept happening after another. He'd need more money because he was coming in over budget. Things didn't get done on time. He needed a lawyer. He had to take a money loan, and it needed to be paid back. Part of me thinks that he's gonna come through and pay me back what he owes me, and swoop in here, be the knight in shining armor. But it's just so absurd that there's a big part of me that doesn't believe that. And that is where this is all so pitiful, is because if he's a scammer, I've been so brainwashed and I've lost everything. It's all I had. It's any inheritance that I could have passed on to my daughter. The loss of money was my future, and knowing that I wouldn't have to work, that I could just make it to the ripe old age of whatever and be perfectly comfortable. The loss that I've suffered emotionally, I think, has even been more traumatic. I can't even imagine a man, a person that could be this bad. So I think of him, I can't think of him that way. My mind keeps me from thinking of him that way because there can't be a man in this world that could be this horrible to have purposefully done what he's done to me. I don't want this to happen to anybody else. If they're real and if the love is real, they're going to want to see you as soon as possible. I mean, it's been 2.5 years and I still haven't seen his face.
Heartbreaking to hear someone's real account, and hear how sad she is, because she thought this was a real relationship, obviously, and she obviously invested a lot of time and energy and money into it. And once again, it's those big promises, those emergencies that are coming up, and I want to see you so bad, but I can't. And so it's just very devastating to hear, especially to hear how it will affect her future and her family as well.
Initially, my wall.
Okay, there we go. All right, so now moving on to these fake profiles and these scammers trying to attract men. And so on these profiles, they will typically say that they're under 30. So they're young, they may be fresh out of college, just starting their careers, and they're seeking an older man. They want an older gentleman to build a relationship with. They might say that they need financial assistance. They're students, they're in college, they're in grad school, and money's really tight. They're just trying to make ends meet. They're very trusting and caring people, and they promise to give you lots of affection, and they seem very genuine. Those are qualities that are really looked after. And they want to take care of you. They want to maybe be a perfect housewife or a perfect girlfriend, and they'll send you lots of very attractive photos, and they'll text you multiple times a day, every day. And once again, it's those sharing dreams of a long life together. So these dreams, these promises of, I want to marry you, I want to spend my life with you. And so they'll promise that one day we're going to meet in person once everything is working out. They want to live with you someday, and we're going to have a long life full of happiness, and we're going to get married, and it's going to be wonderful. But once that relationship is established and the connection is made, now there's an emergency. Okay, so now that we are really into each other and you agree that we should get married one day, but right now I'm short on rent. I have no money for bills, or I have this big medical procedure. I have to go get a surgery, or there was a recent death of a family member and I really need money. I need support because I can't work right now, or there's big funeral costs, or I'm in school, I need to buy books, my account is frozen, or my car is broken down, or I want to travel to come see you, but I'm across the country. I can't afford a plane ticket. Just send me $500 and I'll get a plane ticket and I'll come to you. Another thing is their wallet was stolen, they're stuck in another country, or don't you want to spoil me? I want some new clothes, I want some new makeup, just send me a little bit of cash so I can go on a shopping spree. So it'll always be something. A big warning here. You can actually become the victim of a money mule scam. So a money mule is someone who is transferring or moving money illegally, or illegally acquired money on behalf of someone else. So you might just end up being kind of like a scapegoat. So money mules add layers of distance between the actual crime victims and the criminals. So that makes it harder for law enforcement to actually track everything, because the money has been moved between so many different people. So please be aware of this. So if they're asking you, hey, I'm going to send you so much money, can you send it over to here, or send me a money order, or transfer it to this bank account. So just be very wary. Warning number 2. So as we highlighted earlier, romance scams pose a risk of continuing a cycle of victimization. So once you become a victim, it's very easy to actually be scammed again. So for instance, a scammer is found to be a fraud. They might actually contact the victim claiming to be law enforcement. So saying that they can help them, they're going to get your money back, but you just need to pay me a fee, or they're saying that they're a lawyer, they're going to go and do something else. So it's the same person who's just going and creating a different identity to try and further the scam along and get more money out of you. Another possibility, the scammer admits to initially trying to scam you, saying, yes, I was catfishing you, but I really am in love with you. I really want to build a relationship with you. So let's not trust this. You know, they have lied this entire time, stolen money from you. So they are not, obviously not a trustworthy individual or care about you in the long run. Or victims of the romance scam might revisit the dating site after this relationship has failed and then match with another scammer. So we spoke earlier, that video at the beginning from the FBI agent of a suckers list. So these scammers are connected, they share your information, so people can just keep getting money from you, which is very, very unfortunate. Okay, so here's kind of some consequences of falling victim to this scam. So obviously loss of money, loss of life savings, even loss of friends, or you're hurting your family members. They've been telling you, hey, like you don't need to be sending the money, and you retaliate against them. No, I want to, I'm going to, they love me, you just don't understand. And so it actually causes tension between there. And so you're actually losing your support system. You may start feeling ashamed or embarrassed or betrayed from this scam. And unfortunately, the sense of shame and embarrassment, it often leads to denial of the scam. So saying, no, that scam didn't happen, it wasn't a scam, it was real love, or refusing to report it. So you can't have 100% accurate data because, you know, people are not actually reporting and pressing charges against these people. Okay, and so this is actually a Better Business Bureau study where victims in the US and Canada have reported losing over $1 billion in the last 3 years to these kinds of scams. So it's actually men between the age of 45 and 54 who are the most susceptible to the romance scam. So this is just where we're getting most of those reports. And oftentimes victims will lose thousands of dollars, and not just sending their own money that they have access to, but borrowing money from friends or families, taking out loans, maxing out their credit cards to send these scammers money. So it's not even just loss of their own personal funds, it's loss of other people's because they're so committed to this. Whenever these victims realize they have been defrauded, they are emotionally devastated because of that theft of money, but also because, you know, it's like a breakup, you know, it's this devastation, like this heartbreak. So actually in Australia, there are more suicides than murders due to the romance scam. So that true crime case we talked about earlier was an example of, you know, romance scam gone wrong and murder. But because of all the shame, there's a lot more suicides in Australia. So here's just a few tips to stay safe out there. So please be suspicious of anyone contacting you out of the blue, or date people that you meet in person. You know, make sure you're meeting up for an in-person date, and date closer to home in a smaller geographical area, because then it is easier to meet them in person. Keep emails and text messages short and sweet. So don't share a lot of information with people that you don't know or have only met on the internet. Stay in control, you know, and set your own expectations. Don't let someone try and pressure you or push you into sharing money or sharing details about your life whenever you're not ready to. And trust your feelings. If something feels a little suspicious, trust your gut, okay? Go with your instincts. And remember, these con men and these con women are professionals, and they are very good at their jobs, unfortunately. If you do think that you're a victim of a romance scam, please remember that you're not alone. This is unfortunately very common, and it's not something to be ashamed of. If this is the case, please stop all payments immediately and report it to your local police department, as well as the Internet Crime Complaint Center. And the website is there, ic3.gov, as well as to the dating site where you met the scammer, so that they can go ahead and block their profile so that they don't scam more people. And here's just a few help numbers. And so we have the FTC, the Federal Trade Commission, the FBI Internet Crime Center, which we just talked about, scam survivors. So there's plenty of resources out there to help you. Okay, help is here. And please, if you know a victim of the scam, don't shame, don't blame. Please be supportive. It's not easy to be a victim, and like I said, it can happen to literally anyone. And here's just our information. So like I said, I am from the Texas Senior Medicare Patrol, and we are focused on reducing the amount of waste in the Medicare system. And we also have a hotline where you can report Medicare fraud. It's completely toll-free and staffed by real people. So if you or someone that you know has been a victim of Medicare fraud, please go ahead and give us a call. My personal line and my email is there as well. So if you're interested, or if you have any questions or interested in any sort of presentation, I am happy to come out to your church, organization, community center, and present on more specific information to Medicare fraud. Thank y'all.
Nice.
Angel, do you want to tell us about volunteer opportunities with SMP?
I'm sorry, I can't hear.
Do you want to tell us about volunteer opportunities with SMP?
Oh, mayhaps I do. Is that my next slide?
Oh, no.
Oh, it's not. Okay. So we do take volunteers here. We are a volunteer-run organization, and we have a bunch of super fun volunteer opportunities based on your comfort and level of skill. So we have bag stuffing opportunities where you can get together, stuff resource bags that we hand out. We also do health fairs. And so if you wanted to come to a health fair, represent the Texas Senior Medicare Patrol, that is also an option. And then also speeches, if you love chatting and talking to your community members and educating them about Medicare fraud, then please get in contact with me, and I can get you in contact with our volunteer coordinator to set up some amazing opportunities for you to help stamp out Medicare waste in the system.
Thank you.
Thank you.
Let's, if we can go to the next slide, I'm going to go over the CEUs while you guys are looking at the questions, and then we'll answer your questions when I'm done. For those of you today that are joining us to get CEUs or to receive a certificate of attendance if you'd like, we are set up to provide CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas, or you have a license outside of Texas, you're more than welcome to go through the process and get a certificate. They're complimentary, and submit them to your jurisdiction. But please understand, there's no guarantee. It's totally up to them whether they're going to take them. All we can tell you is we're set up for Texas for licensed social workers and licensed professional counselors. For attending today's webinar, it's good for 1.5 hours of CEU credits. You must have attended the entire live webinar to be eligible. You must complete the Google evaluation form. It should pop up when you close out of Zoom today, but if it doesn't, some companies and some individuals have pop-up blockers. Sometimes your spamware will block it. So no worries. We're going to email that link to you in a follow-up email after today's webinar. The Google survey will stay available to you for 1 week from today, and the certificates will give you about 3 weeks after that to get the certificates out to you. And then if you don't get it, feel free to reach out to me. I do have glitches in my system every once in a while, but we usually get most of them. So I'm going to turn it over to Melinda and Felicia and Angel to answer any questions you guys might have. Well, actually, I want to, let's cover this real quick first. I'm sorry. For next month, we're going to be doing things just a little bit differently. And so I want to make sure I make a big point of this. Next month's Medicare Monday will be about Medicare coverage of preventive services and fake government imposters. But instead of doing them both on the same day, we're going to be doing the live webinar on March 13th at 10 a.m., but we're going to be doing the recording of that where we show the recording and then have live Q&A. We're going to be doing that at 3 p.m. on March the 20th. Please make note of that. It's a little bit different than we normally do, but we'd love to have you join us. So I'll turn it back over to y'all.
All right, thank you very much. I am looking at some questions in the chat. Thank you for Felicia for answering the questions, but I don't think they went to the participants. So I'll go ahead and go over those again. What is an Advantage plan? An Advantage plan is a replacement or an alternative to Original Medicare, where you can get your Part A benefits, your Part B benefits, as well as prescription drug benefits all in one plan. Some people think that it's a supplement to Medicare, but it replaces Medicare. So it's a bundled plan that replaces Medicare. And during your initial enrollment period, you can sign up for an Advantage plan, or during the Medicare Advantage plan open enrollment period, you can also switch Advantage plans or go back to Original Medicare, as well as during the open enrollment season in the fall, October 15th through December 7th. So if you are in an Advantage plan, if you sign up for a prescription drug plan, then that will allow you to be enrolled in Original Medicare beginning January 1st. That was a lot, I know. But hopefully that answers the question of what Advantage plans are and if you can actually change to Original Medicare. And then we have some comments. Con men and women tend to target someone who is already going through a hard time. Yes, they are easy to manipulate at that time. For instance, widows would be a prime target for scammers. Yes, that is so true. And Angel did a great job with going through that information. Unfortunately, I find my dementia patients have been a target because they do feel alone and lost. That is also so true, as well as heartbreaking, because yeah, they do feel alone and lost, and they like talking to people. And so when someone calls them, they're ready to, share their information, not realizing that it could be a scammer. Because as Angel said, they do their job so well. All right.
I see a question.
Yes.
Karen just posted, if you know of someone that is being scammed, but the person is not accepting assistance, can we report the scam to one of the scam reporting platforms? So yes, you can report it. You can report that it's happening. However, if the person who is being scammed does not want to press charges or to change any of the behaviors, there's only so much you can do. Reporting is pretty much the only thing that can happen because they are their own person and it is actually affecting them. And if they're choosing not to, if they decide that this is a real relationship and they're sending money on their own regard, then there's really nothing more that can be done. Yeah, I actually went to a presentation by the FBI, the local FBI here in Houston area. And there was a case where a woman was sending money, like thousands of dollars, like every week. And her family had already reported it. Everyone had told her, no, this is a scam. Don't keep doing this. And so her family actually had the neighbors go and check her mailbox every day and take the checks out of it and go shred it because she was it was just so bad. It was just so bad. And there was nothing that anyone could do. So
yeah, that's sad. I actually had a friend several years ago who was scammed out of $80,000. That included all of her IRA. And then recently someone had their parents, they were scammed out of like $50,000, although they were able to get it back because of what the bank had done. So they were
That's
able to,
good.
yes. So, yeah, so it does happen. It does happen. And so it's important to keep up with what's, happening, and to reach out to those who may be isolated. And of course, the pandemic allowed scammers to do more damage, more isolation for people. So we just have to be more diligent in reaching out to individuals. All right, I think that's all the questions. Let's see. Oh, there's one more here in Q&A. What to do when you receive a Medicare premium bill more than $1,000 when you are a low-income senior? Oh, that's a good answer, Felicia. Contact our office. That's good. Yes, if someone is low income and they are receiving assistance from the state where they have the Medicare Savings Program, QMB, they are not responsible for any cost sharing. So if that is the case for a low income senior, then I would suggest contacting that provider. If someone does not have the Medicare Savings Program, QMB, and they received a large bill, yes, I would suggest contacting our office or your local area agency on aging to find out if there are any local resources to help pay that, or maybe the bill is incorrect. So helping find out if that's an actual copay that the person is responsible for.
The recording of this webinar will be available on our YouTube channel, and you can find access to our YouTube channel on the bottom of all my emails that come out. But the follow-up emails, you'll see a YouTube link below my contact information, and it will be available this afternoon because we have to get it up and going for our 3 o'clock version of this. So you can check after that and you will see it on our YouTube channel. And underneath, just so you know, underneath the recording on the YouTube channel, you'll also see a link to download the slides as well, the presenter slides, if someone wants to print those off and take notes while they're watching the webinar.
We have one more question. Is there a time limit to report a scam?
So it depends on the scam that we're talking about. So for things with Medicare, I believe it's a 2-year period because there's a 2-year period in order to actually get any money back with Medicare. But as far as other scams, I believe it just depends on what exactly it is.
Very good.
And also, I think Medicare is still offering, maybe some compensation for people who report, and there's an indictment or a charge in that. So it's always good to report it.
Some rewards. Wow.
That's right. That's right.
Nice. Love that. Love that. Right.
Marty, I'm wondering about that picture of yours.
No, come on. Can't you see the resemblance?
Is that the only profile picture?
I know, feels a little like catfishing. I don't know.
I have a very good toupee. That's good. Somehow I'm going to be indicted on my scam here. Now, hold on. I want to know, if you're going to send money to that face, wouldn't you send money to this one? Just kidding. Just a joke, y'all. Just a joke.
Are they both on your profile?
Y'all, thank you so much. Melinda and Felicia and Angel, thank you so very much. Thank
All
you
right.
all for joining us. And if you have anybody that can benefit from this, please know that the recording is going to be out there for forever, but also this afternoon we'll be on replaying this and being available for live Q&A. Thank you so much for joining us, and y'all have a wonderful day.
Thank
Thank
you.
you.
Bye-bye.
Bye-bye.
Bye-bye.